Hello, Kita here. I hope you all are doing well. Thank you for tuning in. And this is day 6 post-op from dental implant surgery. Certain words are a little bit difficult right now, not due to swelling or anything like that, but because I have my first set of temporary teeth, and those have a bit of an open bite and a bit of an underbite. So you hear that when I'm talking. There's a lot of air coming out, as well as the word like much. So tomorrow I go in for my final temporary teeth before I head home, and those should have more of a natural curve around the front and the overlapping. I think for me, not having dentures and being completely toothless, having no impressions of the teeth that I had before, they did pretty well. I mean, really, they had nothing to go off of. So that cracks me up. So for this, I think it was really good for healing, and I feel like I'm doing really well. So I still have this little loose pocket here. So what's happening is lymphatic drainage. It's just sitting here. So I've been doing massage like that, and it'll go down in a few weeks. So that can take time, and I'm doing the tapping and I'm doing all the stuff that I need to do. So with the surgery day, they kept me as calm as they could. My blood pressure was really high because I was extremely nervous, and it did go down when I started relaxing. And I believe that it probably went to normal while I was under general anesthesia. When I woke up, there was a nurse with me. We were watching SpongeBob. Like, they did a really amazing job, and they kept me comfortable. They were the best place that I could imagine going to. So I went to Smart Arches in Langhorne, Pennsylvania, and Dr. Simon O was the surgeon, and what I had done by his extremely skilled hands is, according to my scans, I have 2 zygomatics, one on each side, and it looks like he found enough bone here to do regular implants here. They try to avoid doing zygomatics if they can, less invasive, less drilling all the way up the cheekbone. And so I've got a lot of referred pain through my temples, and my jaw is like really, really tight. So that's about as best I can open my mouth. I found out some really neat information that actually made me feel really validated about my oral health experience growing up. So I stopped growing when I was 12. Like, my hands are literally the size of a child. Everybody always remarks on how small my hands are. My feet, if I was not as fat as I am, my feet would be much smaller. When I'm at my normal weight, my feet are about a size 5 to 6. And currently like in size 8, which isn't, terrible. Average size, for a woman. But my mouth also quit expanding for the adult teeth. So the typical palate in your mouth, the roof of your mouth, continues to expand and fuse together when you've got your adult teeth. Mine fused, it's a weird word to say with an open bite, too early. And so what happened was my baby teeth fell out, my adult teeth came in, but there wasn't enough room. And then you get wisdom teeth that start packing themselves in there, and everything starts pushing its way this way. And so I started getting this overbite, and teeth were falling out, and things were moving around and going sideways and crooked, and trying to make room for something that was a child-sized mouth. Adult teeth, when you're a child, you have 20 teeth. When you're an adult, you have 28 to 34, or 32, sorry. because if you get all your wisdom teeth, that's 32. I couldn't fit that. My mouth could not do that. So it created a lot of problems. And when you have that much of a packed in mouth, you can't get a proper clean. You can't, I mean, it just doesn't, it doesn't do what, you know, you would expect, right? To have a properly clean mouth. So the best thing for me now with dental implant teeth is 10 teeth on top and 10 teeth on bottom. He said that was all he could fit. And that's good because that's the size of my mouth. That's exactly what I'm supposed to have because that's my mouth is the size of a child. Now, if I could just lose weight and get back to that child weight, you know, 130 pounds would be probably pretty perfect. We'll see. That's neither here nor there at this time, so I would suggest you don't remark on it because I probably won't be very nice about it. This is about dental implants. But anyway, when I woke up from surgery, they were very good with me. They were very patient about me getting woke up, and the nurse was in there talking with me, like, really great experience. Like, if you're thinking about getting dental implants, Smart Arches is the way to go. I mean, it was the best experience. They were so kind and so patient and so compassionate. And the prosthodontist, Dr. Lay, amazing, very patient with me. I have a messed up gag reflex. Again, small mouth, large tongue. So he was explaining to me that, you know, this is muscle. These two muscles fused together, right? That's what your tongue is. That's why it's split down the middle and it fused together to form muscles. And so when you don't have teeth, your tongue, which is a muscle, is going to kind of expand into that area. So now I've got an oversized tongue and a small mouth. Well, that makes getting physical impressions very difficult. But he told me to wiggle my toes. Weirdly, it worked quite well to get me to not gag. I did gag a couple of times. One was very hard and one where my body kind of reacted and I felt like I didn't have any control over that reaction, where I grabbed my tongue pushed out the impression kit with all the goop and stuff. My tongue pushed it out and my hand caught it and he was like, I got it. And I was like, I'm so sorry. I was so embarrassed. But then the nurse sitting with me, we were listening to the music overhead and I started humming with the impression kit in my mouth. That helped me a lot, and wiggling my toes and just kind of focusing on putting my tongue onto the roof of my mouth. So yeah, for food wise, I've been eating and drinking as much protein as possible. I'm looking over here because my camera's over here, but I need to see what I'm looking at. So Carnation Breakfast Essentials. I got the high protein one also. Mashed potatoes, the little microwavable bowls of mac and cheese, and yogurt, smashed bananas, tomato soup. Tomato soup with the mashed potatoes was really, really good. I tried cheddar broccoli soup, but it didn't go my way. There was too much stuff in the way. Applesauce, Noka smoothies. Now they do have a straw, so I'm just pushing them out into a bowl and eating them that way because they have prebiotic fiber. And the reason I need that prebiotic fiber is because these make your tummy, well, upset, plus the antibiotics. I'm on Augmentin. So I had a sinus lift, which, let me tell you what, I am not mad about my hollow eyes being a lot better. I'm still swollen here, as you can see. Woo! Very lymphatic drainage down here. I mean, I've always had a double chin, but it's been hard, and now it's really soft, so this is lymphatic. It's cracking me up playing with it. I know, you're probably like, stop playing with it. And I'm like, no. Bruising. Again, day 6. 6. Oh. There. So you can kind of see about the open bite there and the underbite. That will all be fixed tomorrow. Tomorrow is August 28th. That's my follow-up appointment. And then I get to go home. Whoop. I get to go home on the 29th, the early morning of. So, yeah. Oh, scrambled eggs is another thing. I could not eat scrambled eggs the day 1 post-op because I was so swollen. So I'm still really swollen through here and a little bit through here still. Can't stop playing with it. You can laugh. It's okay. It's funny. It's really loose. I used to have these really, really deep hollow eyes, but because of the swelling with the zygomatic implants, it's puffed it up. So right now, I would know what I look like if I got filler. So I'm considering that. It brought back some youthfulness to my 48-year-old face. Oh, this is a mosquito bite. Pennsylvania mosquitoes are brutal. Brutal. I thought that Kansas ones were bad. Holy moly. That's all I can tell you around here. There we go. Some of that clear stuff coming out. Okay, so anyway, back to the teeth. Do you have any questions for me regarding my process so far and what I've gone through? Again, this is day 6. Oh, the muscles in my face are twitching my eye. Day 6 post-op from dental implant surgery. So again, I have 2 zygomatics and 2 here. So I've got 4 on top and I have 6 on bottom. So I have 10 total implants in my mouth to hold full arches. I think the bottom teeth are pretty perfect. Yeah. Again, they had nothing to go off of, so it's impressive for a first round. I don't know. I'm still in my hotel room, like I said, until the 29th. Some of you may even see this video after that. I don't know what else to say. Just practicing talking and things like that, which I don't think that I have a problem with because I practice really hard without teeth to enunciate words and to move my face appropriately because it is hard when your face collapses. It's hard to say. Again, open bite collapses after removal of your teeth. And mine did take a couple years before I actually fully collapsed. But I mean, my face was collapsed and sunken in immediately after surgery, but it got worse after like a couple years after my extractions. And I had my extractions done in October 2021. So I was literally without teeth for almost 4 full years. I did not do dentures. Nobody would work with such a small mouth. They didn't have trays that small. They just didn't. Some people had child trays, but I was telling you the amount of rejection that I got in Kansas. I was told constantly, you can't even get dentures because your mouth is so small. There's not enough gum tissue to work with and blah, 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 blah. So I went completely without. I'm hungry. I will tell you that I'm looking forward to the healing process more. Like when I get to that point where I can chew, when I get my final implants, which will be quite a while from now. Probably 4 to 6 months. But I'm looking forward to my final attempt. So my eye is twitching because I'm using my muscles too much in my face right now. I'm gonna go use a heat pack. So after 48 hours, you don't use ice anymore because ice helps constrict the blood from, you know, continuing to bleed, right? And so after 48 hours, you're over that hump. And then you start using heat to relax the muscles and bring circulation to the face to heal. And I feel like that's done a really good job. Oh, I know I'm using the front camera so you won't see it right. Arnica. It's called Arnicare. See if it'll focus on it. Maybe. There we go. It's bruise relief. So I believe that has made me heal a little bit faster with the bruising. Focus back on myself. It fades bruises. It's a moisturizing formula. It did make my skin like really shiny, which I'm not mad at. I have these tiny little packs that you can put in the microwave and the refrigerator or the freezer. So I only put them in the microwave for 10 seconds and they get hot, like really hot. And they start getting big. So when they start swelling, you got to take them out. Also, you know, and I can just, they're kind of cool right now, which feels really good. This implant here is driving me a little bit nuts, but that's okay. And then I've got Biotine mouth spray, which helps keep me moist. For people who don't like the word moist. Lots of electrolytes. I'm trying to think. Ibuprofen and Tylenol. Always eat, you know, taking Tylenol or ibuprofen, both of them. I mean, really. That's about it. So I will follow up. All right. Have a good day.